Just to respond to that a little bit, I think it's becoming more and more over time apparent that the major beneficiary of Obamacare or the ACA are the insurance companies, and we are at a cliff here where we're going to find out, or where we find out what happens when we let the insurance companies write such a plan. We're at a point in which we got to spend $34 billion a year more to prop up a failed plan or come up with some sort of alternative. So, welcome to this joint hearing of the Subcommittee on Economic Growth, Energy Policy, and Regulatory Affairs and the Subcommittee on Healthcare and Financial Services. This is an exciting opportunity for us to address one of the most pressing issues for Americans, the continued rising cost of healthcare. Healthcare costs have been steadily increasing since 1970. The total healthcare spending in the U.S. was just shy of $5 trillion a year. That's $14,500 per person. That's almost 18% of the GDP. In 1970, healthcare spending accounted for only 7%, so it's increased by 150% over the last 50 years. The U.S. spends twice as much per person on healthcare as other peer nations. I don't have statistics on how much our insurance companies make compared to other nations. It makes sense that the overall healthcare costs have increased in the past 50 years. Our country's population is growing from 200 million to 350 million. The problem is not that we're not spending money on healthcare. The problem is that the money that we're spending is being wasted and does not improve patient health. Recent studies show that nearly 1/3 of healthcare spending in the U.S. is wasteful because it does not lead to better patient outcomes. In 2023, that would mean $1.6 trillion spent on health care was wasted. To put $1.6 trillion in perspective, the federal government spent that same amount on total health insurance in 2024, including Medicare, Medicaid, CHIPS, and the Affordable Care Act marketplace subsidies. More than half of this wasteful spending can be directly attributed to administrative expenses. That's why when you go into a hospital or clinic, you see a huge number of people working there who really have nothing directly to do with healthcare. Over the past several decades, the growth in administrative staff has far outpaced the growth in doctors and nurses. Hospitals, insurance companies, and health systems now employ layers of administrators focusing on billing, compliance, reporting, coding, navigating complex regulations other than delivering care. In many hospitals today, there are multiple administrative employees for every practicing physician. These costs are passed directly to patients through higher premiums and reduced access to care. Higher prices, higher premiums, and reduced access to care. At the same time, patients are left completely in the dark about prices. Someone scheduling a routine procedure frequently has no idea what it'll cost or how prices compare across hospitals, clinics, or providers. In almost no other sector of our economy do consumers face this level of price secretiveness. Just imagine how much different our entire healthcare system would be if more dollars were directed towards patient care and less towards administration. This is where technology has the potential to make a real difference, which is why we felt it was timely to bring in experts in technology in the healthcare sector and see what they had to say. Empowering patients with price transparency can drive competition, lower costs, and improve access to affordable care. Today's expert panel of witnesses will provide their perspective on how the current healthcare system costs too much, the leading cause of those rising costs, and how innovative technology in the healthcare sector will make healthcare more affordable. We look forward to this testimony